Hello friends, you are welcome to my YouTube channel. I am Dr. Krishna Chaudhari, cosmetic surgeon, practicing at Cosmetic Laser Surgery Center, Prasad Chambers, Karve Road, Pune. Friends, in youth, facial fat is diffuse, plentiful, and balanced. However, as the face ages, fat becomes unbalanced, showing areas of apparent fat excess and atrophy. These changes appear in set patterns and seem to correlate with the changes in overall body fat. In other words, the face as in the body, increasing fat leads to deposits or fat hypertrophy in certain fat compartments, while other fat compartments remain atrophic. This phenomena may be explained because facial fat is situated in individual compartments. One can conceive that the face does not age as a confluent mass, but as individual fat compartments. And further, the facial aging is in part related to how these compartments change, with both aging and fat storage. The transfer of autologous fat into atrophic facial areas can restore a sense of balance and youth. Fat is ideal for those patients wishing to add contour and projection, and is frequently the most economic choice for gross voluminization of the aging atrophic face. Cheeks may be divided into four areas: the central malar area or cheek apple area, then lateral zygoma, buccal hollow, and lateral cheek. Fat grafting is very economical, and unlimited source from your own body is available without any chance of allergy or rejection. This is most important. Fat restores natural youthful volume and smoothens creases without manufactured fillers. We don't need to overfill the area to a great degree. Final results are in place much sooner, reduced chances of needing touch-up injections. Your treated areas feel completely normal and natural, and procedure, as I repeat, is very economical. Friends, please watch presentation about young man with hollow cheeks who opted for fat injection over the fillers. Friends, in human face and body, its shape predominantly depends on the subcutaneous layer of fat, which is, if you see carefully, very artistically draped. Particularly in the face, absence or excess both create changes in the face which normally nobody likes. When fat is less in certain areas, like cheeks, it gives hollowness appearance and aged look. This patient, 35 years male, desires to improve his hollow cheeks. He is having this problem since his childhood. Otherwise, he is very healthy. He is conscious about it cosmetically, and moreover, he is a physical fitness trainer in gym. So he want to look smart and attractive also. Front view shows very clearly a round depression, a hollow pit on both sides in cheek. Otherwise, you can appreciate he is quite healthy person. Very thick neck and healthy, good looking face he has got. Well sculpted jawline, chin prominent, nose. That is how he is worried about. If you see these green arrows, shows covers the depression area on both sides. Side view shows again the same thing, hollowness. Both side hollowness is not of same size. On left side it is oblong and on right side it is a D shape. Here the arrows I have marked is the main the punctures through which the fat will be injected. Usually from 3 points, if fat is injected at different levels at different places, it gives a very smooth appearance and smooth feeling also. And survival rate is high because it has been proved beyond doubt that if fat is injected and placed in small droplets at different level, different planes, different depth, in a crisscross three-dimensional, the fat survival rate is very good. Now, as a filler, we have two choices at present. That is the synthetic filler, which is also equally popular. It's a very freely available, ready-made, but you need to replenish them every 6 to 9 months. Reaction, infection, and migration is always possible. And worst part is very expensive by our Indian standards, and every 6 to 9 months recurring cost is there. But body fat grafting, there is an unlimited supply. It is your own body fat. 1 to 2 sittings may be required and usually enough. No reaction or infection is possible. However, absorption to some extent in certain patients it does take place and may require a repeat or touch-up procedure. Calcification or calcified small nodules, cyst formation is always possible remotely, but they are harmless. It is very, very cost effective. It is poor man's filler, and you can repeat n time and you can have as many as cc's of fat injected you want. So my preferred choice is always fat injection, but sometimes patients are in great hurry. They do not want two procedures. They do not want downtime, morbidity, so they go for fillers. Procedure is done under local anesthesia. So office procedure, no admission is required. Downtime 2 3 days. Some bruising, swelling is always possible, and on face it is more visible and bothersome. So patient needs to take rest. But eventually all the bruising disappears totally. Fat is extracted, centrifuge to separate the blood fluid water from it. Then fat is injected into multi-layer, multi-directional small droplets for better survival through a very tiny puncture and cannula. It's very cost effective. You can compare the before and after photo, see how chicks have come up. Please do not hesitate contacting us. My address is there. I practice on Karve Road in Prasad Chambers, Pune, India. For info, free consultation, please WhatsApp 937-350-4565 or 9822058916. Cosmetic surgery Pune @gmail.com is email, or also you can log in to my website www.cosmeticsurgerypune.com.